And we're going to start the meeting that way. Then we're going to go into our introductions, and then and I'll make a few comments, and then we'll start the proceedings. So, Ms. Lowry, I'm going to give you the microphone and the video, and you go ahead and read that post into the record for our legislative officials and our audience. And thank you.
Just
right.
Before we get going, for anybody that doesn't know, Danette Lowry, 11 years ago, she had an idea that she was going to do something about the crazy situation. So she called together about 700 or 750 of her closest friends. We were at the Lapeer County Courthouse. It was a heck of a day, there were a number of things going on. As I believe, I think Senator Daley was there. He was getting pictures of the 5,000 one that was going on in Lansing. But it's been 11 years, and we've come an awful long way. Unfortunately, for us, Danette had to move. She moved away. Her and her husband, they're in the hills of North Carolina. Beautiful area. Kids have grown up very nice. She's a hardworking lady, and everybody that was a part of this group, and we always have strived to do the kind of work that she did. So I can't say enough good things about her. We miss her greatly, but with this format here, Danette, perhaps we can get you. We'll just you can kind of we'll remote you in every now and then. So without further ado, here's Danette.
Okay, are you hearing me?
Yes, ma'am.
Yes.
Okay, it's great to be back with you guys. I can't tell you how much I miss all of you, and I still follow everything that's going on as much as I can on Facebook and through different media. And so you guys all mean a lot to me, and I miss you. I still probably know Michigan politics more than I do North Carolina politics. And so there's part of me that you'll always be home, and you're all near and dear to my heart. When I was in Michigan, I was busy raising our kids, and I was homeschooling and doing the Tea Party, which I swear was a full-time job at that time. And so I wasn't working as a nurse, but I actually am a nurse and had worked previously at both University of Michigan Hospital and Beaumont Hospital. And so since I've come back down here a couple years ago, probably about 4 years ago now, I went back to work, and I worked in organ transplant for a while, and working with harvesting organs from people that have passed away, and did that for about 3 years. And then a year and a half ago, I went back to doing what I had experience in Michigan prior to raising my kids, and that is being a hospice nurse. And so I have been doing that for about a year and a half now. So you all didn't know me as a healthcare worker and a nurse, but that is my background. And so this letter that I wrote, or this essay that I posted on Facebook, comes largely out of that position that I've held. And so I mention in here having, actually I don't mention it in here. I had made a separate Facebook post about the fact that out of the previous 3 weeks, I had been canceled for every shift that I was scheduled to work that was inpatient. I do both home care and inpatient hospice. And all of the inpatient shifts that I had been scheduled for had been canceled. And I'll preface that by saying that prior to March, I could usually have worked 24/7. They always had shifts available. They could not get me to work enough. I mean, literally, if I called them and said, hey, I can work in an hour, they'd say, great, we'll take you for however long we can get you to work. So, so that's kind of a little bit what's been going on. And then today I found out that every shift I am scheduled through May up until June 1st, which was the last that I was scheduled, has been canceled. So we are, and my understanding is that this is happening to nurses all over the country. We are a county of about 250,000 people. We've had 45 cases of corona and 3 deaths. So we have a very, very small percentage of cases and a very, very small death rate. So that's kind of where I'm coming from as I wrote this. And so Bill has asked me to read it to you. I don't like reading things that I wrote, but I will do that. So it's titled, "And Seven Others." Do you remember when Kobe Bryant died a few months ago? I remember thinking at the time how sad it was that headlines were everywhere that read, Kobe Bryant and his daughter Gigi were killed along with 7 others. I kept wondering about the families of those 7 others. How did it feel to know your loved one was just part of a collective while 2 other people warranted having their names repeated again and again? Was the value of their life such that they didn't even deserve having their name mentioned? Just 7 others was sufficient. All of the events surrounding the COVID-19 pandemic have brought up a lot of issues and a lot of feelings and opinions. It is indeed a complex issue with so many things that need to be considered. I have taken what I have come to learn as a less conventional approach, especially for a healthcare worker. I have been told I am not compassionate by neighbors and yes, even family. I have been called dangerous, irresponsible, selfish, and an idiot. Now, I will admit I have many faults. However, I do not believe lacking compassion is one of them. That is the point that I want to elaborate on. I have been pretty vocal about not agreeing with shutting down our economy and for believing we have overreacted to this whole virus. And if you know me, I tend to be pretty vocal about whatever I believe in. I agree it is a terrible illness. I understand we have to address it differently because we don't understand it. I feel horribly for those that have lost loved ones because they caught coronavirus. I know adjustments need to be made in how we are operating and precautions need to be taken to reduce the number of people that contract the virus. Believe me, the science is not lost on me, nor is the tragedy. But here is the thing. I can't just look at the people dying from coronavirus as a tragedy. When I look at this situation, I also see people that have put their blood, sweat, tears, and dreams into building a business only to now face losing it. I see people that have worked hard to buy a house for their family and they will now have to let it go back to the bank because they can't make the mortgage. I see school children that can't get fed because they can't go to school, the only place they get a solid meal in a day. I see elderly people with high blood pressure and diabetes that cannot get in to see their doctor because offices are shutting down and won't do more than take telehealth visits. Their chronic illnesses will worsen and they will die without needed healthcare management. I see alcoholics that can't go to AA meetings and without the support of their comrades will return to drinking. Drug addicts that won't receive group therapy. Women that are abused, stuck in a house under stress with their abuser, resulting in more abuse. I see an increase in suicides in a few months due to the stressors mentioned already. I wonder how many will soon be in poverty that had not been before all of this. And I feel not just compassion, but heartbreak for these people. But there is more. And I think this is the piece others might be missing. I see the 7 others. And I can't just discount them. And quite frankly, it makes me angry when others do. I have seen a lot of people die, and I mean a lot. I say it just as a statement of fact. Others that have chosen to work in areas of nursing like I have can say the same. Often, I visit a patient in a nursing home, laying alone in a bed, living out their last days. And I know death will come with no visitor and no one to grieve at their graveside. I remember patients from my organ recovery days that did not even have a next of kin that could be located to notify of their death. I think of a tiny baby I cared for years ago. He had no eyes, ears, or voice. He also had no one to care for him, literally. I loved holding him. I often wonder what happened to him. I all too often stared down at patients, also during my organ recovery days, with self-inflicted bullet holes, and I would wonder how bad were things that they chose to take such drastic actions. There are patients that I visit in their homes with no floors and cardboard for ceilings. They will die there. They probably won't even have so much as an obituary in the paper. And people dying from alcohol-related illnesses. Please don't even get me started. If people are so concerned about the number of people dying from corona, can we talk alcohol? Who among those so concerned with the number of people dying from corona are ready to ban the sale of alcohol so that we can eliminate people dying from the effects of this stuff? That is what I thought. No one. Yet many more people die from alcohol-related issues, and we do know how to stop that. I remember going to the funerals of kids that I cared for that died from cancer. Their families would talk about how they couldn't relate to the friends at the funeral because they had stopped visiting long ago. Why, I would also wonder. Did their life stop mattering? Even my patients that are surrounded by loved ones that leave this world well cared for. I often look at their grieving family, trying to figure out what they will even do to make it through the next day. And I wonder at how the rest of the world just goes on, totally unaware of their grief. Does anyone even realize that people are dying around them every day? This is a question that comes to me quite frequently. And now we have this, and thousands of Americans have died because of the virus. Thousands more are sick, and suddenly people care. They want something done. They are willing to go to great lengths because of these deaths. They want to do everything in their power to prevent one more person from dying. Where is the compassion and concern if you are not among those clamoring for absolute and total devotion of all resources to stop this? It is a situation of national emergency, for goodness sakes, don't you understand? And it is to some degree. Again, I am very aware of the science. But here is the rub. While several hundred people might have died from coronavirus today, or even a couple thousand now, there were 8,007 others that died today. But their name won't be in the news. Their cause of death won't result in a public outcry for something to be done to stop it. There will be no money to support their family. Society will not come to a screeching halt in order to find a cure for their disease. They might not even garner a few donations in their memory to whatever society might represent their disease. Public officials and politicians probably aren't offering thoughts and prayers for these poor souls. Do the deaths of those from corona matter to me? Of course they do. But are their lives of more value than the 8,000 others that died today? If the news kept a running tally of how many people died in the USA each day for any reason other than corona, would anyone even pay attention? To me, a life is a life. The cause of death on your death certificate does not bring you more notoriety because of what it says. However, that is exactly how it feels to me right now. Suddenly, it's a really big deal that an illness is killing people. I only wish people cared every day because people die. I wish people were passionate about finding a cure for various illnesses every day. I wish no one had to die and no one had to grieve, ever, for any reason. A few hundred people died today from coronavirus, and there were 7 others. Thank you.
You're very welcome. I want to thank her for giving us sort of a medical background as one of the founding members of our Tea Party. And with that, I'm going to move right along, and I'm going to read my introductory thing for the audience. I thank you very, very much. It gives us the perspective for the purpose of this meeting. So with this said, I'm going to read this into the record for the audience so that the audience understands exactly what we are doing. And our agenda has been posted so everybody understands what the agenda is, but here's what we did. We have a panel of 3 legislative bodies. We have our U.S. Representative Congressman Paul Mitchell as a panel member. We have Michigan Senator Kevin Daley in our district as a panel member, and we have our Michigan Representative Gary Howell from Lapeer County as a panel member. And I want to read some background as to what we are as a Tea Party. As conservative Americans, we adhere to constitutional principles as a free democratic society. We believe that government is there to protect the people's God-given or inalienable rights as delineated under the Bill of Rights and it should not restrict any of these rights. The core beliefs of the Michigan Alliance, as adhered to by the Lapeer County Tea Party, is a belief in limited government, fiscal responsibility, and free markets. Okay, with this in mind, we forwarded to our legislative panel our organization's thoughts on matters we wanted them to think and reflect upon so they could address our concerns. And these are, I provided 4 before and I'm adding a couple, but here's what I provided the panel. Number 1, the conflicts posed by the political and social sciences, as Ms. Lowry has indicated, versus medical science. Okay, does the principle of Charles Darwin, survival of the fittest, apply? That's number 1. And you know, that goes along with President Trump's theory of herding, or do we do something? Number 2, how do we operate a free capitalistic market economy under a government mandate to socially distance? That's number 2. Number 3, is the governmental edict of Governor Whitmore restraining access to certain activities or imposing restrictions upon civil liberties legal or constitutional in light of the emergency declaration based upon the health pandemic? Number 4, I added this one and I did provide it to the panel. The Federal Commerce Clause of the U.S. Constitution, Article 1, Section 8, which provides Congress shall have the power to regulate commerce with foreign nations and among the several states and with the Indian tribes. How is that? Does that impact how does that impact a quarantine or stay-at-home executive declaration by a state governor and the economy, or conflicts with constitutional fundamental rights? How does that work? The Commerce Clause versus the government's edict to stay at home. And I added the last 2 thoughts, and you guys could reflect upon this as we proceed. As it relates to the separation of church and state, how can a governmental entity place sanctions upon religious organizations in the manner and method of how they pursue their worship? And the last one, did we overreact to the virus causing irreparable harm and injury to our society? Those are some of that's just the thoughts and things that came across my mind. We're 37 days into this, and I see that a virus by one individual or somebody who made a mistake or somebody who was devious and then covered it up caused a global pandemic, and the economy of the world has been brought to its knees, particularly the United States. With all that, I'm going to allow the panel members, and I'm going to allow the order to be as follows. Paul, Congressman Mitchell, I'd like him to go first, just like the agenda says. Senator Daley will go second, and then third will be Representative Gary Howell. You're allocated about 10 minutes or so each, and then after your statements to us, we're going to just open up the phone lines and the videos, and we're going to have them ask you questions appropriately. And I wanted to throw those topics out and those subjects out because this is the most significant thing I have ever been a witness to in my lifetime. And I have seen devastation everywhere. So with that, I turn the microphone and the video over to our representative. Where's Congressman Mitchell? I don't see him on my.
He's on there.
He's on there. All right. Paul?
Unless you throw me off, I'm still here.
Wait a second, Paul. I got this for you. You see that, Paul?
No, I don't see
Still
anything.
got it, buddy. Yeah.
I appreciate that.
Okay.
Let me start out with kind of addressing more of your questions than just kind of the federal role. But let's start with the virus in China. I learned a long time ago, never attribute to intent what could be attributed to stupidity, ignorance, or just raw accident. I'm not sure, and I don't know if we'll ever know whether the virus came from the wet market there or whether it came from the lab there and someone just was exposed and carried it out. To think that somehow or another it was a intentional act, multiple people in the intelligence community have said that they don't believe it's the case. There's no evidence of that. I think it's one of the 2 things I said, and one thing that China did absolutely do is lie to the world. They lied to the United States, they lied to the World Health Organization about the virus, that first it wasn't transmittable to humans, then it wasn't transmittable between humans, and we'll go through the whole long list, all of which wasn't true. The information in terms of China's instance of cases and deaths are also massively underestimated based on what the intelligence world is saying. Significantly underestimated. They could have had, the range is pretty broad, between 300,000 deaths in China. And there was one piece of information that came out that will shock everybody, was there's cell phone subscribers between the end of November and the end of March went down by 20 million. Now, it could be people didn't need their phones, they weren't working as much, a variety of things, but those are some pretty big numbers. I believe they had several 100,000 deaths in China. They're just not accounting for. This is the Chinese government. What do we do about it? I've said, and I said to Governor Whitmer when I talked to her this weekend, and I said to her when this first started out, that we can keep people safe from a health standpoint, as well as allow our economy to run, allow people to have a life. That if we followed the CDC guidelines and something called the CISA, Critical Infrastructure Guidelines, Standards Guidelines, we can keep people medically safe under most circumstances. There is an at-risk population. The data right now I've seen is that the average age of a death in Michigan is about 73 years old. If you are old, I'm only 63, I'm not quite there yet. If you have comorbidities, that is more often than not if you're obese or you have diabetes, serious things like that, your risk of dying goes up considerably. Your risk of dying also goes up, by the way. If you're in the intensive care unit, put on a respirator, 66% of those patients are dying. It's not a good scene in that case. But up to that, by what I call physical distancing. That is, keep your distance from people you don't know well. We got rid of, and I was part of getting rid of shaking hands in Congress. I thought that was a habit that when you're a member of Congress or even a state senator, or you go to these events and you shake every hand in town. And the reality is that you make your name the infection connection, because you're just wandering through the place, passing every germ known to man. There's customs we have need to end. I think social distancing makes sense when you're dealing with a virus that you don't know what it is and what it does. And we still don't know that, by the way. But I think we can still keep the economy going. Some other facts about the virus I think everyone on the call needs to understand, and I talked with the governor about. First, Iceland has tested a large percent of their population than any other nation I'm aware of. What they found is 50% of their population were asymptomatic positives. We found out today that Teddy Roosevelt is being held in port longer in Guam because the asymptomatic positives, after a 14-day quarantine, were still shedding active virus. They're still active. We also found out that you can be negative one day and positive the next day. That testing, this whole hue and cry about testing, doesn't solve the problem. It's simple. And last but not least, the whole discussion about we'll do serological testing and we'll identify people that are resistant. I can go through the science of it, but the reality is they don't know what that level is yet. They don't know what the immunoglobulin M level has to be in fact be resistant. And there are cases of COVID-19 that are recurring in some people. Again, mostly people that have significant health problems. So yes, we can run our economy, and we need to do things to protect people that are more likely to suffer seriously from this disease. I think some of you may have seen the data that came out of California, that the percentage of population out there that were asymptomatic positive was enormous when they started doing testing. More people have had this in the country than people believe, because it started in China in late November and people were traveling back and forth. That's why it spread the way it did. A couple other questions in terms of you asked. Well, let me go first. What we've tried to do at a federal government is to provide disaster assistance. It was clear to us that given the unknown nature of the disease or the virus, given the way the states and municipalities were conducting themselves, that we had a significant challenge on our hands in terms of our economy, in terms of the ability of people to support themselves. We could ignore it, but the devastation was going to be considerable. We chose to make a significant investment in people and small business and the healthcare system which is being challenged. If we had not done that, for example, Beaumont, McLaren Health Systems, they had to expand their intensive care units by 2 or 3 times. Detroit, Henry Ford as well, because of the number of people that are going to intensive care. If you got sick and you were older with this, you got pretty sick. So we put money into all of that, and we will vote this week on additional funding for a couple of things. The payroll protection program, the paycheck protection program, to help small business. We'll put additional money into hospitals because that's needed as well. Both those things are critical needs at this point in time in the economy. I talked to the governor on Saturday, and I pushed her very hard that what we need to do is do a public health order with guidelines. What these are the CDC standards. These are the CISA standards. This is what we expect people to do to protect our communities, themselves, and their families from COVID-19 and other viruses until we get this under control, but not to micromanage the economy, not to say exactly what businesses can and can't open, what industries can, or how it is you run your business. I mean, the discussions that you're going to allow capacity of 50% in a restaurant, for example. Well, restaurants can put up plexiglass between their booths and you're safer than 6 feet apart. It did not make the governor happy when I told her that, frankly, I had more experience in the private sector than she did, and we really ought to give them standards rather than tell them what they're going to do. But she's on her path. It gets her quality TV time. And last but not least, the Federal Commerce Clause. The Federal Commerce Clause, the courts ruled repeatedly, has to do with interstate commerce, has to do with we regulate and commerce between the states and the manner in which they conduct it. We regulate commerces across the states. We put out money as a disaster relief program through the states because we are a republic. We have a constitution and the states have rights. And whether we like or not what Whitmer's done, and they don't, the federal government does not have the ability, and I relate to the White House with all due respect, no, the president cannot decide to open up the economy across the nation. He can't override state action on executive orders. Our legislature can try and rope that in, but even under that, Whitmer is going to play games with that. But it's not the federal government's role. And unfortunately, that's doing damage, in my opinion, in Michigan and across the nation. I think that answers the questions, unless I'm missing something, Maurice, that you asked about. And I'll yield back until people have questions.
All right, then we'll reserve all the questions until after all the presenters. So we'll move on then to Michigan Senator Kevin Daley. Kevin, are you there? Did he leave? Bill? I don't hear you.
He's there.
All right, let's move over to Kevin then.
Okay, if you can you hear me now?
Yeah.
And I didn't mention this when we first got started, but occasionally we lose.
We lost.
We're going to do our best.
Kevin?
Kevin, we've lost the audio.
Here, give him make a chat to him because we lost his audio.
How's that? Is that better?
There we go.
That's better,
Okay.
Kevin.
I must have accidentally hit a button here. So obviously we've been, our last day in session before we went back to extend the order was actually we were in session on St. Patrick's Day, March 17th, and then we went back on, I'm not exactly sure what that date was. Maybe Gary will remember when he gets up here to speak, but to extend the order for a little bit longer to agree with what the governor was doing. And I know that caused a lot of grief for a lot of folks out there, but it was something that we were still in the midst of the beginning parts of this. And I can't disagree with Danette. I often wonder if this thing has been overblown, but we do have a responsibility, and the governor does have the power now. There's basically 2 laws that give her that power. The Emergency Powers Act of the governor from 1945 is the first act. I think the act that she's more likely to be operating under now, or is operating under now, is the Emergency Managers Act of 1976, which actually mentions epidemics in it. So it actually gives her the power to take over under an epidemic, and it's actually listed right in the law. That's Public Act 390, if anybody wants to look that up, of 1976. So that's the act that she's operating under, and that was kind of the reason that we talked about in the Senate, that we felt we didn't have a lot of choice but to extend her order. Of course, she put out the remarks for the media early on that she was going to go out 70 days. Well, we weren't going to allow that to take place, so we decided to go into session, do it very safely, put the extension on till the same as what the federal government was acting under, and that was till April 30th. So that's where we're at today. Of course, the big problems we have is the governor herself and the way she's empowered with this orders. The orders she's putting out, she's out, I think last I looked, I think it was number 54. And the irregularities is the biggest problem. We've got, you can't buy seeds, but you can certainly get your weed, is one of the statements that's going around out there, because she finds that marijuana is a essential business. And I don't quite understand that, but that's the way she's been operating. I think that's the biggest concern from the people out there, is the irregularities of who can and can't sell. We worked very hard over a period of a couple of weeks to get the greenhouses and garden centers to be able to operate at least at a curbside basis. We meaning myself and the majority of the people in our caucus, I think probably every one of our caucus members have faith that our business people are smarter than government is. They know their business. They know how to operate. They know how to do things safely in their business. These facilities were ready to operate on a call-in basis, and some of them started doing it. And I believe some are still doing it today, which is fine by me. That's what I do if I was a business owner. But unfortunately, we put the pressure on her. Finally, she came back in when she renewed the order, and everybody knows she put more restrictions on the big box stores, because that was one of the big arguments they had. You couldn't buy your vegetables and seeds and stuff at their facilities, but you could buy them at the Lowe's and the Menards and the Big Boy or Home Depots.
Sure.
So consequently, she comes back and stops them from selling the products there, and turns them all upside down again. So and then of course add on the motorboat issue, which is a whole nother ridiculous statement. People can operate. The problem seemed to be, I think, in areas like Marysville, they had people coming up from the Detroit area and basically having parties on boats and putting a whole pile of people in there, and just not using good common sense with this going around. And so consequently, she says no motorboats. So you can't even take your kid, technically, you can't get in a motorboat and take your kid out fishing. It's absolutely bizarre. So there's just a lot of craziness going on out there right now. One of the concerns that we're working on, being as I'm chair of the Ag Committee, of the ag issues that are out there. We had one very big facility out in North Dakota closed down, a meat processing facility out there. There's only a few of those facilities across the country that process most of the beef and the meats for the country. And those facilities are getting overtaken by COVID, because the people do work very close and together and close circumference. So they've recently, Smithfield's Meats, and that was Smithfield's Meats. The one that's in Plainville, Michigan, just yesterday had announced that they had over 100 people testing positive for the COVID. So they are buckling down over there as well. So we're really concerned, and we've had some conversations today with our Ag Caucus, the chair of the Appropriations Committee on Agriculture, that we want to redirect some of the money for PPE for those facilities, so we don't mess up the food chain terribly. We already have messed up the food chain greatly just by the fact when you shut down every restaurant in the country, basically, all this meat was processed in different ways to go to restaurants than it is to grocery stores. So there's a real concern. These facilities cannot, retool, I guess you'd call it, to create different products for the grocery stores and not for the restaurants. So it's very hard to, you're selling bulk materials to restaurants. You can't really sell it that way in the grocery stores. So there's a lot of issues when it comes to food. But the bottom line here, I think, is that we need to get our businesses started back to work. We need to get people back in their jobs, get them back to work. The next issue we've got is the issue with unemployment. We're hearing from many constituents out there, businesses that are trying. I have an example of a local restaurateur here that has about 9 different franchise restaurants, and they're his own restaurants, but a chain of restaurants across about 5 or 6 different counties. He employs about 900 people. When this order went into effect, he just decided to close the restaurants completely and only open or not even do any roadside or curbside service. And but he decided here a week or so ago, he thought maybe he would open 2 or 3 with curbside service, and he started calling his people back. He employs about 900 people. He found 9 people that would come to work. Problem is they can access more money by taking unemployment and getting the extra $600 a week. So why should they come to work? My understanding, that's not a federal issue. That is a state issue. That's in the governor's order to, the problem is she's given the ability for people to say that they're afraid to go to work because they're afraid they'll get sick. And so that's why they're not coming to work. That same issue is going on at some commercial or some industrial businesses that I've heard from as well. So the workforce is not going to want to come back. So we've got some work to do at the state level to try to fix that. We are going to be having a caucus meeting tomorrow. We just got the agenda for it just as this meeting started. We are going to be going over the executive orders that we as a caucus believe are going to be important that they stay or at least modified going forward after the end of April. But we do have every intention of, I think, moving forward to take that executive order powers away from the governor, start getting back to some, or at least forcing her to come to work with us and move on with it. So with that, I think I will wrap it up, and you can go on to Gary.
Thank you very much, Kevin. Again, please stick around. We will be having questions for the panel after the conclusion of the last speaker. All right, Representative Howell, are you there?
I am indeed. Have I got audio as well as video?
Okay, Gary. Thank you again for your attendance. So again, I'm going to allow you time to speak on these issues that I think I've provided you information on. So carry on.
Very good.
And thank you.
First, I want to thank the Tea Party for providing a forum. You know, there's very few opportunities in Lapeer County to be able to reach out and speak to our constituents directly. The Tea Party has done a really great service, not only today, but in the meetings they hold regularly. So I think you were owed a debt of gratitude by the public in Lapeer County for making these kind of forums available. I know I can speak for Kevin and Paul. We've been spending a huge amount of our time recently in trying to help our constituents. Numerous phone calls, numerous conferences. The unemployment compensation thing is a mess. I wish our good governor would spend less time on national television and more time managing her unemployment agency, because it is run amok. But we've got trying to answer questions on unemployment. People are not getting what they deserve. We have these small businesses which are being literally driven out of business because there's no common sense application as to how we can run these things in a safe manner. But first, before I go into the details, I'd like to talk just generally for a moment. You know, this whole situation is a real challenge, as we all acknowledge, because we got to strike a very delicate balance. We got to take into account the public health. We have to take into account the economy, which means jobs and businesses. And we need to take into account our constitutional rights, which are being infringed upon in some cases. The federal Constitution, as we all know, provides a fair amount of power to the states corporately. Probably not enough power, in my opinion. But because of the federal system we have, President Trump is doing his best to guide things on a path that will get us into a safely opened economy. But because we are a federal system, that means the governor And we as legislators have a lot more authority in some cases than even the federal government does as to this particular circumstance. Unfortunately, we have a highly partisan governor. She is obviously campaigning for vice president. She is choosing to spend an ungodly amount of time dealing with the media as opposed to running her administration, in my personal opinion. I know I have been personally unsuccessful in trying to get her to at least consider some of these concerns. The greenhouse landscaping situation, which was mentioned earlier, I had delivered a letter to her. I've never gotten a response. If there is any consideration being given to those folks, it's not obvious. The situation we're in right now is she has her emergency powers until April 30. We met on April 7th as a legislature. She wanted us to give her unlimited power into June, which we Republicans were avidly opposed to. We did give her 23 days. We gave her the balance of April to have some leeway. I think that's a legitimate grant of power. Unfortunately, I don't think that she has wielded that power appropriately or responsibly in many cases. So the rubber's going to meet the road. We are going to reconvene on April 30th, and we're going to make a decision as a legislature as to what we're going to do going forward. As Kevin mentioned, we're certainly going to be looking at the individual orders that have been put out. I would hope, and I always believe, that there's a reasonable opportunity for reasonable people to work together. I hope she gets down off her partisan high horse and works with the legislature to eliminate many of the disparities, the unfairnesses, and the terrible adverse consequences of some of her orders. We really need to focus totally on the issue of safety as opposed to these so-called essential services. The trouble with the concept of essential services is somebody gets to define those services. You're picking winners and losers as to whether you call a particular activity essential. To me, that's the wrong approach. We had to look at what can be safely conducted. What business can be operated, whether it's distancing, whether it's masked, whether it's curbside service, whatever. If that business can be safely conducted, it ought to be opened and conducted in that safe manner, as opposed to the current situation where you were simply driven out of business and put into a horrible financial situation because you're not called essential by the bureaucrats that are making these decisions. So April 30 is going to be a very interesting day in Lansing. As Kevin mentioned, there are two statutes that we're dealing with here. The 1945 statute, which obviously emanated out of World War II, unfortunately has no limitation on the governor's extension of time. The 1976 statute, however, has a mandatory maximum of 28 days. That is the statute we are relying upon as a legislature. That's the statute we used to grant her 23 days earlier in April. It's important that we maintain that position. A law like the 1945 law, which appears to have unlimited time frame, cannot be constitutional, and it cannot be good for a republic or for a democracy. The thought that a governor can simply declare an emergency because she says there is one could be abused in an incredible way. That's again why I'm hoping we negotiate a solution before April 30, because otherwise they're going to be in a constitutional headbanging, which will end in the courts and is a messy way. And I'm afraid it's going to do further damage to our economy. So I'm hopeful, skeptically hopeful, that our governor will work with us and modify some of these things. Now, I do not pretend to be an expert on every business nor healthcare issues either, but it certainly seems to me as a layman that we need to phase this thing in, and we need to start out with businesses that are seasonal in particular. The landscaping and the greenhouse businesses are good examples of ones who, if they miss very much more time, are going to be destroyed. They do their business this time of year. They've got to get out there. And it ought to be a relatively straightforward and simple manner to do these things safely. If Home Depot and Walmart can operate safely with much larger clienteles, I cannot understand how Campbell's Greenhouse in North Branch can't operate safely with a much smaller clientele, as an example. The hospital situation, which Danette mentioned, is particularly outrageous, I think, and it's particularly bad for our rural hospitals. They're the most underfunded hospitals, obviously. And when these orders have gone out that they cannot do many procedures, many surgeries, even though they have a fairly tiny number of COVID patients, that's destroying them financially. That's got to be addressed, and it's got to be addressed quickly. There's lots of other things we need to deal with in this. Those are just some examples of things that I feel are very important. I hope we listen to our president on this. We need to move forward, protect the public health safely, get the economy operating out of compassion for our business people and our workers, and respect the Constitution. I'll be happy to answer any questions when the time's appropriate. Thank you.
Thank you very much, Gary. I just have two thoughts before we turn it over. I see we may have 7 or so questions from the audience, but for everybody, including our Congressman Mitchell, we're all three of us, all three of you as the panel, including myself, are very familiar with the Metro Detroit area. And about 80% of the COVID cases for the state of Michigan emanate from the Tri-County area. And, you know, I just thought that there's 2 issues. One is that President Trump set forth his guidelines, but he didn't set forth an edict. It was declared a national disaster, but he had a guideline to suggest that social distancing might be the cure, but he didn't impose it mandatorily upon everybody, including the mask. So that's just one thought. And number 2, the thought is in Michigan, well, Governor Whitmer is looking at the state as a whole, and we know that the Upper Peninsula is dramatically different than the Lower Peninsula, and Lapeer is dramatically different than Oakland, Wayne, and Macomb County, where 80 to 90% of those cases are. And I just thought that as state legislative people, we need to impose upon her to think about phasing in gradually in zones where areas that are not affected at all should go ahead and be operational, considering the fact that Fauci, our CDC expert, is indicating that based upon the testing results now, this is a significantly less disastrous disease to the mortality rate, as our first speaker spoke about, than the common flu. We're still below the flu ratio. I think we're 40-some thousand now. The flu last year was 50-something, and the year before was 61,000. So I just think that Governor Whitmer has to realize, or somebody has to impress upon her, the Tri-County area needs to adhere strictly to some guidelines, but the other guidelines to the north need to be relaxed. So I just want your thoughts on that, and then we're going to turn it over to the audience to ask additional questions. So anybody can comment on that if they want to. If you don't, we'll just turn it over to the audience. Anybody want to respond to that?
Yeah, very briefly. Obviously, regionalization makes sense. There is a very different incidence of the disease. And the only reason there's not a difference between Lapeer County and Detroit or Mackinac County and Detroit is we're all in one state, and she's made it one size fits all. If we were like North Dakota or Iowa or other rural areas, we'd probably have very different requirements, which makes more sense. That's my comment.
Well, I know that there is some, go ahead, Paul.
Let me suggest that I think that the fundamental problem is the way that the governor's approached this entire incident by telling people what they can't do. I asked her before she did the first stay-at-home order, I talked with her Saturday before. I said, you know, what we need to do is lead people. We need to tell people and reinforce what they need to do to keep themselves safe, their families safe, their communities. By doing that, by talking about safety standards, by talking about the critical infrastructure standards, we could in fact make sure people understood what they needed to do to protect themselves so there wasn't a massive outbreak. So we didn't overwhelm the healthcare system. She chose not to do that. She chose to issue orders. She seems comfortable with that, but that doesn't lead people well. What we need to do is simply, rather than even regionally, I talked to this past weekend, we just need a public health order saying these standards actually will keep our communities safe, keep you safe, and we need to step back from what was said earlier, picking winners and losers, or one business opens and others doesn't. Are you in this region or not? It just doesn't work. The issue, I told her she was micromanaging the economy, and in so doing, she was going to screw it up. She just step back and lead, not micromanage.
Kevin, did you want to respond also, Kevin?
I was just going to add quickly when it came to the regionalization operating, that is one of the ways that we are looking at in proposals from the Senate is, it's going to take there's a lot of smart people out there that could figure out possibly a way that could be done to some degree and allow businesses to open up. But the biggest problem we have is that Southeast Michigan, we know that in Lapeer County, we all commute down there to work and they come up here to work. And that's part of the problem with us being so much in close by with them. But so that's one of the issues that we are looking at as well. That's all I had.
All right, with that said, I'm going to turn this over to Bill. Bill, we have, it looks like 11 comments, maybe 11 questions that we have from our audience.
We will probably have more than that. So how we're going to do this, folks, is if you have a question, just write your name down in the chat and I will get to it. Please leave yourself muted and I will unmute you, and so you can ask the question. We want everybody to be able to ask their questions, but I'm trying to keep people as muted as possible because when you start getting 30 or 35 people with background noise, it can really make it hard to hear. So again, I will start calling on people. The first one that I had was Rick Warren. So Rick, you are on, so go ahead and ask your question.
Good evening. Wanted to start out with Danette. Danette, I appreciate what you did. Kind of explain to all of us on the medical side, which is what there's a lot of people around here that believe that and what's happening and the deaths that are out there. And it's sad that people are dying. This is something we're not going to be able to prevent. As it was said, it was a war that we can't see. When we're in combat, we know there's people dying, but we still have to get out in the field and work. This is the same scenario. We still got to keep the country moving. With that being said, that's where we started, was on the medical side. And you did a great job, Danette, and I appreciate it.
Thank
then
you.
Then we got into the Congress, and we got into the senator and the state reps, and then we get down to the county reps. We're all trying to figure out what we could do out here. I'm sitting here quarantined because my wife has that bad case of asthma. I know there's a lot of people all around your neighborhood. There's people that are locked up and in fear. They don't even know the world's even moving right now. They're so scared. During wartime, got bombings going. There's people in shelters. There's people that didn't come out of shelters till years later. That's kind of what's going on right now. I see this and it's really dangerous. We have medical side talking and they have their opinions. And Danette seeing it on that level, but we're listening to the top scientists and stuff. Well, they're not going to agree until we get everything cleared totally. That's not going to happen. The country has to get moving. Then we have the attorney side, and they're like, yeah, and then we're going to, so what we need to do then is we're going to end up with all these lawsuits. Well, that's that side, and we know that's going to happen. Those don't happen fast. Then we get down to the financial side, and of course the economics of it, and they got their opinion, and we need to get moving. But we got to look at this country as one big whole thing. We got to get all those parts moving. And with her saying that she's going to demand us to stop this or stop that and step on people's constitutional rights, this is going to get uglier. It's not going to get pretty right now. Even you guys are going to go down there right now to the Capitol, let her know what your opinions are, where we stand. She's going to play that political game. It's not going to change. She's going to have more protests going down there. That's coming, but it's going to get uglier protests. That's what I'm scared of. So the sooner we can figure out how to get ourselves back out in the field working, let us know that everybody's going to be exposed to this virus. Every one of us. A lot of us probably have already had it, don't even know it. They're testing people in California. They got that prison down there in Ohio. A lot of them been tested positive. Nobody knew they had it. So most of us will never ever have to experience that fear. But the issue that we have going on in this country right now is the word fear. And we got to get rid of that somehow to let her know that if they don't, these people are going to come out of the woodworks. They're going to come out mad, and it's not going to be pretty. So that's where I stand on it. I don't know what issues could be happening with it, but all the policy making right now, none of it's going to matter until we get things moving. And that has to happen. And Trump's doing a good job doing everything he can to get us moving. These businesses that are taking money that is being passed down right now should be going to smaller companies. I don't know if you heard of Shake Steak a few minutes ago. Trump spoke. Well, they're already going to be giving their money back because they were too big of a company to take that money, taking it from people who need it. We got to feed these people on the ground. I heard Governor Cuomo today.
Rick, I don't want to hold you up, but I want to kind of get through this so we could ask some other ones. But you bring up the fact with the companies that have taken a big piece of that pie that was supposed to go to the small people. Congressman Mitchell, could you address that particularly?
I think that part of is two parts of it. There's national media on some groups that got money that your questions about. Ruth Chris Steakhouse is the golden child of that. They were limited to $10 million out of the initial money, which was, as you know, is a fair amount of money. And especially the left media, the Democrat media, played that up as well. It didn't help small business. In Michigan, it helped a great deal of small businesses. They've also said that we didn't get our fair share. In fact, if you deal with it proportionally, just strictly proportionally, we got more than our fair share. But you follow let's not fall into the talking points of the Democrats here. The way it was structured, restaurants in particular, if they're restaurant groups or franchises, whatever, they could apply it as separate entities. So you ended up with Ruth Chris, and you ended up with I think pork belly was another one that was a question. Or pot belly, I'm sorry, I don't go there, but pot belly was another one that got into there. Beyond that, you've got a variety of folks that got smaller amounts, but the maximum they could get was $10 million out of this thing, which is a fair amount of money. Don't get me wrong. When you're talking about a program of this kind of scale, the SBA we put through the SBA for this Paycheck Protection Program 14 times the amount of money SBA usually loans a year. And the additional money we're going to put out will top that. I know there's a question about is the spending wise? We can talk about that. But most of the money has gone to small businesses. And I've heard a lot from in Lapeer as they were working to get the money and as they ultimately got the money to keep their businesses afloat. So nothing's perfect, but it's as my grandmother used to say, it's better than a stick in the eye.
Thank you, Congressman. All right, our next person that has a question is Tom Pettiford. I hope I'm saying that right. So Tom, you are unmuted. Go ahead and present your question.
Yes, can you hear me?
We sure can.
Yeah, my question was around the unbridled spending that Congress is doing, especially at the federal level. It's really aimed at Mr. Mitchell. He's in the heart of the Congress there, and I don't know where the philosophy comes that we think I understand we're trying to save people and businesses, but nobody's looking at the debt. It's like ignored. How can we continue to spend? I believe the yearly debt right now, or the unfunded commitments are somewhere around 22 trillion.
23.8 trillion after the CARES Act, and it's going to be another $500 billion with the thing this week, and that doesn't include the debt that's going to come up because of reduced federal revenue resulting in a higher debt from base spending. So that's the numbers as they sit here today.
But it's like the Republican Party used to be the party of fiscal conservatism, and I don't see any of that. It's kind of like the Uniparty today.
With all due respect, first, and I'm sorry, but lately I've had all kinds of fun on both sides of the spectrum. You made a comment that Republicans have forgotten the debt, and I gave you a dollar by dollar blow on the debt up to what's projected to be as of the end of this fiscal year, given revenue shortfalls. So I have not forgotten it, the person you elected to represent you. It troubles me a great deal. I'm an economist. I see the numbers, but here's the other number that I'm glad we've done so far. And that is unemployment went up nationwide in the state of Michigan at record levels because of decisions governors made to shut things down, to take the CDC standards and various other things and go to shutdown orders and closing down businesses. Now, you guys can argue till the cows come home, Trump could have stopped it. I'm here to tell you the Supreme Court would have said, no way in a New York minute. So our choice was to let how many small businesses go belly up, how many people not be able to support themselves and feed their families because they suddenly lost their checks. I grew up in a family, we went through the GM strike, the 72-day strike or 67-day strike, 67 days in 72. We got food stamps, we got a Thanksgiving basket. It's the problem is a lesser of multiple evils. We couldn't ignore what was going on in various states, New York, New Jersey, Michigan, Ohio, Pennsylvania. The governor of Pennsylvania fell off the deep end and went all kinds of wild. We can go through the list and the millions of jobs that are being lost as a result. Does anybody really seriously think we could have simply ignored that? I couldn't. And the decision really, there's no other way to put it, and I know this is being taped and God knows who else is listening, the decision really sucked. But I tell you what was the worst thing to do was to not care enough about the people that try to run their businesses and keep them afloat and the families trying to feed their family. And the trade-off between that and having to tackle our debt problem in the longer term, I voted for it. And I'll vote for the increase this Thursday because I can't tell people we don't care enough to help them deal with their problem in something they didn't cause. This isn't because people made bad debt decisions or bad financing decisions. This is because people made bad financial decisions. They didn't do any of this. This was done to us. This was done to the American people and to the world. And if I'm animated, I am because the Chinese lied to us and we ended up behind the 8 ball in terms of addressing it. So that, I appreciate the question, but I really quarrel with the basis of it because I assure you one thing, I can give you a dollar for dollar blow on what the debt is. And the biggest driver of the debt, by the way, and is entitlements. We can talk about that anytime you want, but this may not be the best call. Thanks.
I understand that. Thank you.
Thank you, Tom. We very much appreciate your question there. I believe Lisa McLean had a question. Give me 1 second. There we go. And Lisa, you are unmuted.
Thank you. I think you actually answered the question at the very beginning, which was, is there any way that we can open the state up or even regionally? I do believe there's a big difference between equally and fairly, but Maurice asked that question. I think I got a pretty good answer to that. So thank you.
Let me hop back in because it's not the governor's decision of what is fair or equal. You know, my grandmother said years ago, and my mom did, I'm sorry, fair is in the eyes of the beholder. Her responsibility is to provide guidance and information to the state on how to keep yourself safe, your family safe, your community safe, to provide information on CDC standards and the critical infrastructure standards. And then as I talked to her Saturday, I said, you know what, if you've got a bar that's running at 100, got people jammed in there, elbow to elbow, butt to butt, then fine them. If someone's having a block party in their backyard with 100 people there, then fine them. But the idea that you can't have a birthday party with your kids, or there's a vet that is doing neutering of rescue dogs that got a letter from the state threatening their license and told them to cease and desist. Now you tell me what that vet is doing to threaten public health.
Nothing.
So the idea that I will not accept that she ought to be able to decide this regionally or decide what's fair or what industry should open up. With all due respect, I guarantee I've got more private sector experience than she has, and no one made her God. Sorry, it's just that there's a level at which I get sick and tired of you giving her an inch on this. No.
I agree with you.
Congressman, I think we all appreciate your views on this. I personally, I've got a question. We had a couple questions that have been texted in, but one of them, this one goes out to both Kevin and Gary. The Republicans control the majority in both houses, and there's a lot of people wondering. The governor, absolutely, we understand she is the governor, so she has clearly the narrative. She has the executive orders, but when we don't seem to be hearing a lot, excluding yourselves, and we hear from you guys at the paper, and you guys are pretty good about getting around this locally here, but statewide, Senator Shirkey and some of the other leaders, we're not hearing a lot, and we would like to hear somebody rooting and saying, you know what, we don't agree with this. Whether or not it's right or wrong, or how it's going to get decided, we just don't. It doesn't seem like there's a lot of people that are voicing and being very vocal about that. I'd like to get both of your thoughts on this and what you think.
If you want me to start, I will. I'll let Kevin speak to Senator Shirkey as to what they're doing in the Senate. I know they're doing quite a bit. In the House, Speaker Chatfield, I can tell you, is engaged on a daily basis. We are not rolling over for the governor, but there are different ways to solve a problem. And sometimes beating somebody over the head directly is not the most effective way to get something done. And I'm a subscriber to the approach that you only start beating them over the head after you've demonstrated you cannot work out some improvements. We're on a short timeline. We've got just a few days before April 30th. We need to get these things relaxed. And that's our sole focus.
Can you hear me now?
Yes, sir.
Okay, great. And you know, pretty much what Gary said in the Senate is the same way. Mike Shirkey is speaking out more. He felt the same way. Mike is a person that really wants to try to work bipartisanly, and for a short period of time, or for the first part of this time, the governor was working with Chatfield and with Shirkey and listening to the suggestions they had. That really fell apart right after the extension of that order was approved on the 7th. And he literally now has been directly told that she is actually telling people not to talk to him. So it's coming from that angle that we are not getting the ability to work with them. So I think you're about to see a little different attitude coming from the Senate very shortly. So.
Okay. Kind of relating to that, again, this is again to.
Hey, Bill,
yes.
Bill, let me interject something here. Can I, before
Sure.
you make a comment? Kevin and I have had lengthy discussions on this, and I think I have also with Gary. It appears to me, and I want to make this pretty clear, this governor is taking advantage of the press coverage, as Congressman Mitchell has pointed out. And both you gentlemen, all of our panels indicated that she seems to be aspiring to a higher office through this video game that she's playing. What I'm concerned with is our leaders are not responding to her access to the press on a national level, and I think we should be. And the only way we got national coverage is by the conservative coalition in their protest march and our rally around the Capitol, and that got great coverage throughout the national media. I am concerned that our leaders in the state of Michigan, and it's a crucial state for what's going to transpire in November, need to be more vocal and get access to the national press. And Kevin, you and I discussed this, the local press is basically ignoring the Republican Party in their response to her statements. It's very offensive to me, being a conservative guy looking at this, and if I had hair, I'd be pulling it out, Kevin. And you guys know how I feel, but I just look at her and I'm like Paul Mitchell. I understand that time has come that we really have to pressure her to do the right thing for this state, because we are really hurting here now. The national economy, to me, is bankrupt. The figures are whatever they are, but I will tell you that if we don't do something by the 30th, and remember, the United States is the engine that runs the world. The United States can't get the economy going, and they can be broken down to their knees in 37 days. We are in a world of hurt. So we need to use somehow the national media to get more exposure to what is happening here and how stupid the actions are of the leadership here, turning our state into a travesty. So that's just my comment. I'm going to mute myself and let let you guys respond to that.
Okay, kind of relating to that for our state legislators here. As we roll up to the 30th, I got to tell you, I was hopeful that maybe she might do something and maybe acquiesce a little bit, but she doesn't seem like a lady who is really getting ready to give in or give a lot. I'm wondering, is there discussion about what our options are going forward as we get into the 30th, and what might that look like? What are some of the, I mean, what kind of hopes do we have? Because it's just very troubling that, again, we can go into a store, but we're not allowed to, we're not allowed to buy certain products. We can't, if we have a home someplace else in Michigan, we're not supposed to drive there. These are just, these are things that would be spelled in America with a K instead of a C. And it's just very, it's very disturbing to an awful lot of folks. And I see more and more people that are just, the pressure's on, and we're just hoping that something is going to change. But what do you gentlemen, where are your thoughts on that?
Hey, Bill, let me start with one piece of information I share with the governor that I think has an impact on some of this. They're trying to get more money. Well, first, the governor asked for flexibility in the federal money that was sent to states and municipalities to cover the costs they had for preparing and dealing with COVID. They want flexibility. What she wants to do is revenue the states lost. They want more revenue. The bunch of the governors, and she's part of the group, they want 500 billion, yes, that's B with a billion, more in federal money. I have shared with the governor that, I won't support more flexibility, as she puts it, in terms of money. We allocated it, appropriated it for specific purposes, not to make up revenue. And I will not, and I'll actively work against any more money to states and municipalities. And the reason I say that is, this past Thursday is the first day that the Office of State Employer, the state HR arm, met to talk about whether they reduced hours, payroll, laid off people. 50,000 state employees have all been earning the same thing they were earning, theoretically working from home. No one's been laid off. Now, you telling me they're issuing liquor licenses right now? Are they inspecting bars and restaurants? We'll go through the list of things that aren't being done, but people are being paid for. And they expect the federal government and taxpayers to pay for it. My response to Gretchen when I talked to her on Saturday was, fat chance. I'll leave it to someone else or what they're going to do at state level.
Can I interrupt here?
Sure.
Can you hear me?
Yep.
Okay, yeah, Paul, I want to respond to that too. Also looking at, she wants state money to go there. We don't even get money from her. She's been holding on to a lot. One of the things I'd like to see you guys pass is to get the money down to the counties, get it down to the local level so we can distribute it in each county. And instead of trying to figure out who's going to do that, because there's going to be counties around here that are not going to get any of these funds if it does come down when they finally pass it. But we got to concentrate on local people, whether it's a small business person or the counties, where we could take care of our neighborhoods. And we could talk amongst ourselves to figure out how we're going to handle each other. If you guys could propose something like that and say, listen, you want it for your state, let's do it by county, and get those counties divided up and each one get their funds and let them take care of themselves. We don't need the state, we don't need the federal. We need to take care of ourselves.
We put $150 billion out until the governors allocate that effectively. It was not dedicated just to states. Until they actually work with municipalities, help cover the costs, we're not going to let her off the hook. I suggest that all of you put her on notice that you're not going to tolerate it, because I'm not going to simply pour money at it in hopes that she does the right thing. And she's not alone. New York, the members of Congress in New York, by the way, Republican and Democrat, feel the same way about Cuomo. He keeps every dime that comes into the state that's supposed to be helped with municipalities, and he sucks it all up and spends his state government. So good luck. But keep work.
And I could just say, am I on, Bill?
Yes, you
Am I
are.
on? Okay. I would just say that, as I said at the beginning, we are sitting down, our caucus is going to have a lengthy meeting tomorrow to go over the EOs. It's too premature to say what the plan is going to be. And I know that Shirkey and after we have these meetings, I'm sure that Shirkey and Chatfield will get together and talk about what the House is probably doing a similar thing and see what we can come up together in the next, what do we got, 9 days here to have a plan together. And that's what we're working on as we speak.
Okay, thank you, Gary.
Yeah, a couple of comments. One about Paul's point about having over 50,000 state employees. It's a point well taken. I find it appalling that Whitmer's Unemployment Compensation Department can't answer the phones, can't get the internet done, can't get benefits to people. Where the hell are we in terms of reassigning some of those employees to help people instead of just paying them to sit home and allegedly do their job from home? Also a comment about our county commissioner's comment. There's no doubt that local government governs best. The closer you are to the people, the better off you are. I'd have far more faith in the Lapeer County Board of Commissioners deciding how to allocate funds for the benefit of Lapeer County than I do what Lansing. In the bigger picture, which is how we deal with this in the next few days. As an attorney, I'm particularly focused on the constitutionality and the legalities involved. We've got these two statutes, and we do not want to get to a point where the governor is simply asserting under the 1945 law she can do anything she damn pleases as long as she pleases. I want to get a resolution of this by April 30th because I don't want to spend our times going up through the courts trying to get an interpretation while Rome burns, which is a real danger if we can't come to some understanding.
Okay, thank you, Gary, very much. We do have a question. Deb Summers has a question. Let me find where she went here. My screen keeps moving. There we go. All right, Deb, you are unmuted, so go ahead and state your question.
Well, I just wanted to let you know I'm a Lapeer County resident for over 30 years. I'm a real estate agent. Was quite successful last year and was a member of the Tea Party when it first started. Obviously, I'm conservative and I listen to everything that's been said, and I think Danette is amazing. And I think all the information is kind of what I thought it would be. My biggest concern is the government is making money where, there's no income being generated. People aren't working. And eventually it's going to collapse. And, it's coming. And that's, I guess, my question is, are you guys as concerned as a lot of my friends and family are?
You want me to respond to that? To answer?
Sure. Yeah, you guys
Simply to answer that question, absolutely we're as concerned as everyone is. We want to get it back going. We're already talking about negative supplemental budgets before the end of the year because there's no revenue coming in at the state either. So we're looking at, in the appropriations committees, we're looking at a shortfall this year of a couple $2 billion, possibly. Next year we could be talking, depending on how long before we get businesses going again. A lot of these businesses aren't going to open back up, unfortunately, because of what we've done. And so the government is who has shut them down today. And we've got to get them back rolling again, and we've got to get the revenue moving again and make it as easy as they can to operate again.
Yeah. Can you hear me?
Yes.
So yeah, I guess.
Let me just.
Go ahead.
Excuse me, let me just interject here. I've got a message from Congressman Mitchell. I know that we're approaching the 90 minutes that we allocated for him. Paul, you have to leave, do you?
I do. I have to leave. I start today tomorrow too.
Okay, so I'm going to thank Paul. I'm going to ask our other panel members. Can you stay around for a little bit longer so that we can address some of these other questions?
Yeah. Yes. Thank you.
Gary and Kevin.
Gary,
If you're asking me, I can You told us this is 90 minutes, so I've scheduled other phone calls. I've got a conference call yet tonight.
Okay.
All right, well, let's
All
just finish up with this one call then, and I think
Sure.
then we're going to have to, yeah, go ahead and finish your thoughts then on this issue then. Go ahead, Kevin. Kevin, did you want to, did you finish your comments for Deb Summer?
Yes, I was finished. Yeah, I was finished. Yep.
Gary, do you have any other
I have
comments
a
on
brief,
this?
yeah, I have a brief comment about it in that, the Democrats always want more tax revenue. And they simply have forgotten that you only get tax revenue if the economy is functioning and people are making money. If they don't change, they're going to destroy our economy, and there's not going to be enough tax revenue. As Kevin points out, we're already going to have a serious shortfall. They got to get their act together, and they can't think this money is coming from the golden goose, because it's not.
Okay.
That's
I'm
for
going
sure.
to,
Does Paul have, because he I know he's got to leave. Paul, first off, thank you for being here. Is there anything else that you wanted to add to the discussion this evening, or final thoughts for us?
Well, just let me,
let each one of them have, each panel member can have a couple minutes to final thoughts. Because it will be on their time limit.
well, just let me,
Go ahead, Paul.
let me express that I agree with the concern about what's left of our economy if we don't start to phase back into some version of life. I think life's going to be a little different. I was asked by Beckman and others what getting back to normal. I think we're going to have a new normal. It's not going to be a regular. It's not going to be business as usual. I don't think it is. What it does mean, though, is the sooner we get back to people working, businesses planning how they're going to operate, people getting back out and living their lives, is the better off our economy will be, and more importantly, the lives of everyone we care about, our constituents and the residents of the district and the state and the country are. It is not healthy to have people holed up in their house, feeling they can't talk to their neighbors, feeling they can't go outside and do things that have become part of our lives. So I have made that point every way I can to the governor. I've talked to Gary, Kevin. I talked with Shirkey. I've not talked to Mr. Chatfield. I tried to talk to Shane. Everyone involved in terms of state decision making, that we need to hold the line with the governor in terms of opening up the economy and not micromanaging it, opening up people's lives, letting people make informed decisions. Guess what? We have constitutional rights. People are adults. They're big people. They can make decisions. And yes, some will make stupid decisions. Oh my God, guess what? But this what we're doing to our nation is not healthy. And I will do everything I can to move beyond it while also supporting it in the interim. As I said earlier, it is not an easy decision to spend what we spent. Somewhere around $26 trillion in national debt, depending on the interest rate. I'm an economist. It gets ugly. But our choices are to let our entire economy collapse while governors manage to screw it up. And some of them are doing a fine job of it right now. So I appreciate you having me on. Thanks very much. It's a pleasure to work with Gary and Kevin, everyone, our delegation, all the local leaders. It's been great. I'm around for a few more months until they send me home in December or January, I guess. Technically, January. Thanks, guys.
Yeah.
Thanks, Paul.
Maurice, you have any last stuff?
All right, let's go to Kevin for his closing comments. Kevin?
Yeah,
we'll give
so
you a
am I coming through?
Yes, sir.
Okay,
Yeah.
I won't take but a minute, but I didn't mention when we first started, and I wanted to mention thanks to Danette for being here, because, and even before 10 years ago on that April 15th in 2000 on the courthouse lawn, I remember I think it was the very first rally you had on the 4th of July up in North Branch. If you remember that, in the vacant lot where it used to be the lumberyard, where the lumberyard was that burned down, and a good crowd of people there. And I was running for office at the time, my first time for the State House, and you let us get up and say a few words, and that was great. But this has been a great, I've always held the Lapeer County Tea Party up in Lansing as the best Tea Party in the state, because this group is And Danette started that and did a really good job of really keeping it on track and not radical, and we really appreciate that. But we've got a lot of work to do, and I know Gary is ready to kick. I'm ready to go back to Lansing. I was ready to go back to Lansing so that I can shave a week ago. But we're hoping next week we can start turning this thing around and get the businesses back to work so that we can get the revenue flowing, get a little more normalcy out there. I want to get back and see my grandkids again too. So we're working hard to do it, and I appreciate having this meeting tonight, and thank you all for coming.
Kevin, thank you very much, Kevin. And we'll get the closing comments from Representative Howell. Gary?
Thank you, Maurice.
Just concluding. Well, thank you.
Sure. It's a real pleasure to be here and participate in this. As I said at the beginning, the Tea Party provides a real important public service to the people of Lapeer County to have forums like this. I think we need to look at things practically. Things are going to change on May 1st. One way or the other, they're going to change. I have faith it will get worked out. I have faith we're going to begin to phase the economy back in. We shouldn't be fooled to think the economy is going to get jump-started. It's going to take time to phase it in under the best of proposals from President Trump and our other leaders. But we will get it done. And I want to end on a note of optimism. America is the greatest country on earth. We have fought world wars. We have dealt with the Great Depression. We have dealt with the Civil War. We will deal with this. We will come out on the other side, and we will be proud Americans for having got it done. Thank you for having me here tonight.
Thank you very much, Gary. And
That was great, Gary. Thank you.
This is our first approach at doing this. This is, again, the new digital age and social distancing application of our electronics.
And we will be drug kicking and screaming.
Yeah, we will be doing. I'm just going to make one concluding remark. I've been watching something that's very interesting on television. It's a new program. It was the documentary on that great basketball player, Michael Jordan. Interestingly enough, in his career, he had early in his career a broken foot. And they thought his career was going to be over. And he did the analysis as what Trump was doing, the analysis for this pandemic. It's an application. The doctors told Magic Johnson, he says, not Magic, Michael Jordan, that your career would be over if you continued to play. He says, what is the percentages? He says 10% that you could sacrifice your career. He says, well, the flip side of this, 90% of the chances that I'm going to succeed. And they said, yeah. He says, well, I'm going to play. And he played, and look what he did. So I'm like Gary, I'm kind of holding out optimism that, like Trump, he's a very optimistic guy. We have the ability to do this. Now, Paul understands that we're bankrupt as a country right now, fiscally beyond reproach. But if we don't do what we're doing, we'll never get these businesses running, and we'll never get the thing rolling. And yet Wall Street still seems to be somewhat regaining its strength that it had before this pandemic. So I hope that those people out there just keep the faith, and we do have to keep our conservative values, though, and impress upon the governor that you have to use some common sense. That's really what I'm seeing, a lack of total common sense and her dilatory tactics of sitting 2-3 weeks late in her response to things, and then talking to the president and the vice president, and then following suit, and then trying to take credit for the good things that happen is amazing to me. But you guys in Lansing, our legislative leaders, keep up the good work, and let's see what we can do. And I thank you very much for your attendance and participation, as always. You know how I feel about you guys, and I thank you very, very much. And for our audience, again, it's a novel approach. We'll get a little bit better at this when the questions become, when the system comes a little better to us. And so with that said, I think we'll adjourn our meeting for today and thank everybody for their participation. Have a good evening, everyone.
Thank you, everybody. And anybody, if anybody, we do have Danette and a few others on here, so anybody wants to stay around afterwards a little bit and just unmute and just a little free for all, that's fine. And but again, thank you guys, and thank you for everybody who attended.
Hey, I would like to say,
Thank you.
if I could make a comment to Danette. Can you
Sure.
guys hear me?
Who is it?